years, our approach to mental health has started to evolve, but there's still a stigma around suicide, and it's more important than ever to address it. A CDC report over the summer found the suicide rate has increased by 60% among kids and young adults since 2011. Keirston Parham, the lead recovery and peer services coordinator at UPMC Western Psychiatric Hospital, is here to talk more about Suicide Prevention Month, which is this month. Is that correct? All month long.
It is.
So as we have a couple more days here in the month to really talk about this, it can be a difficult topic to approach. So how do you start having that conversation?
It's been stigmatized.
Yeah.
I think that there's so much stigma around it it makes it really difficult. And I think people are scared to bring it up just in general. But we do have to ask. We do have to be blunt and ask the question if someone is suicidal or if they're having thoughts of killing themselves.
Right.
We have to do that.
So what are some of the common misconceptions that people may have about this?
I think that there's a couple big ones that come to my mind. The first one is that there's a certain person, a certain demographic, like this can affect anybody.
Right.
This isn't something that just, but I think there's that. People think it's a certain group or certain person or certain demographic, and anybody can be impacted and affected, and anybody can have those types of thoughts if they're feeling that hopeless, that lost, that hurt, right? So that's one, I think that another thing is people sometimes feel like it's weak or a sign of weakness if you reach out and ask for help. Another big one is going to be that people may feel like sometimes like if I bring it up or if I talk about it, is that going to increase the chances of people having those thoughts or wanting to do those things? But whenever we shed light on something, it offers us more opportunities to help people.
I want to ask you about your shirt. It says minutes matter. Minutes
matter, absolutely. So, I mean, it's really a good idea to be quick whenever you see someone who's in trouble, like throwing a life preserver in the water. You want to be quick as possible to get someone help. Minutes matter.
I think it's really hard too, because when you're in that situation, if it's someone you care deeply about, or even if you happen upon a situation, you don't know what to do, what to say, how to approach it, and to do the right things. Like you mentioned, like you don't want to increase thoughts or increase the risk of it. And so, I think that's why it becomes a little difficult for family, friends, and even just regular people.
Absolutely. And I think that it's important to let people know you care. They can't hear that too many times.
And the warning signs, because I think this is, we hear often about depression, but how do you know that this is really going on if somebody isn't opening up?
Right. Well, of course, the obvious, which you're not always going to get, would be like, I'm suicidal.
Right.
I want to die, so that would be an obvious one. But it could be a range of influx of emotions, right? And constant tearfulness, crying, mood swings, that type of thing. Sometimes people give away their worldly possessions, things that mean the world to them. You may also hear statements like, it doesn't matter anymore. It's not going to matter after today. The world would be better off without me.
When in your position, are you working with kids, adults, teens in your position?
We work with everybody, with the recovery department. I have a group of people that make up the recovery department that have lived experience, and those people also range in ages, and we support.
Because I think too, before life really gets difficult, we hear about kids who are having thoughts like this and depression increasing among kids. Do you see that in your position too? Absolutely.
I think that not just the same or similar stressors that parents have, there's extra stressors now with the pandemic and returning to school and isolation and things of that nature. So all the resources and all the contacts that people had, you're trying to rebuild those things.
Do you find that there's a different approach in having these conversations or addressing this between kids and adults?
If there's
suicidal risk or suicidal behavior?
I think that people are so fearful to talk to children about this, but education is going to help them.
Yeah.
And education is going to also help young people help their friends when they do know the signs or the risk factors or whatever. But I do think it's difficult sometimes for adults to approach and talk about. I do think that the more we talk about it, the easier it becomes for other people to talk about it.
Yeah, you're doing a lot of really great work helping people. Thank you for coming on today, KP.
Thank you for having me.
And we want to share this information too. If you or someone you know is experiencing a mental health crisis, you can call or text 988 immediately. Just like KP said, minutes matter. You can also chat with someone online at 988lifeline.org. Trained crisis counselors are available 24/7. It's free and confidential. We'll be right back after the break.